From the Chronicle podcast system, this is SLP. SLP stands for Shear Listening Pleasure, featuring your host, Neil Shear. In each episode, Neil offers his opinions and comments, and speaks with his guests about dermatology, and, sometimes, one or two other passions. Support for the SLP podcast is provided by Leo Pharma Canada. Neil's guest today is Dr. Boluwaji Ogunyemi. He is a dermatologist in St. John's, Newfoundland and Labrador. He is Assistant Dean, Social Accountability at Memorial University, a writer, essayist and keynote speaker. If you have a question for Neil or his guest, or want to be in touch at any time, just send an email to slp@chronicle.org. And if you attach a voice clip, we might even use your question on an upcoming episode. And now, here's your host, the derm boss himself, Neil Shear.
Well, welcome to our podcast today. And I have great fortune to be speaking with Dr. Bolu Ogunyemi, who is in St. John's, Newfoundland, and as a dermatologist, he's great, but all these other aspects that are so important to the social fabric of caring as doctors, and also to what I believe are the high ideals that we believe we have in Canada to either do things right or correct them when they're wrong. When you think back on your career now, retrospectively, was there a spark or something that motivated you? And then as you look back, you've always come back to that sort of thought just to hold on to what you really need to prioritize in your life and your career?
I thought medicine and healthcare, making contributions in those fields are important ways to help individuals, help communities, and help society. So that's my way to contribute. And health inequities are important. There are many other inequities, but they're important inequities I'm here to help to correct. So for me, always interested in science and in individuals and helping folks. So I see medicine as a way to do that.
Of course, that makes you think immediately, if you're going to change the world, to go into dermatology. I say that sarcastically because I know we do these kinds of things. We really do. And I think dermatologists, despite sometimes the public perception, care so much about all aspects of health, the breadth from youth to the very elderly. But what brought you to dermatology amongst all the different options? And it's not an easy program to get into.
I think dermatology is a very important field. I think with the pandemic, we're actually seeing some ways that dermatology is contributing to medicine, to healthcare more broadly. For example, we are truly pioneers in virtual care, virtual medicine. We've been doing it for some time in dermatology. As a practical example, during kind of the height of the pandemic here in Newfoundland and Labrador, I was personally responsible for about 18% of all virtual consults in Newfoundland and Labrador myself. Dermatology is the most common reason people seek virtual care through that platform. Number one is adult dermatology. Number two is pediatric dermatology. And between those two, that's the majority of all of the e-consults. So this is an area that we've been pioneering for some time. And of course, we relied more and more on virtual care during the pandemic. And virtual care is important because it does have the potential to help with we talked about health inequities earlier. For example, besides doing a clinic in rural Labrador, I do a lot of my follow-up and sometimes some initial consults virtually. Right. So I'm kind of closing the gap that they have in terms of having access to care and having to drive because I can see them virtually. So I think, in that way, we're actually leaders in medicine. It's a good example to see how medicine as well as other institutions are shaped by history, right? So the need of skin of color dermatology is because dermatology as a specialty was created when Canada and the US as well as the UK were a lot wider than they were now. And we're realizing that in order to provide equitable care in patients of all skin types, that we need to really rethink how we define diseases in our specialty. I think that many other specialties can kind of take historical and equity-based lens, but in dermatology, it may be the most apparent because our organ, of course, is the skin as well as the hair and the nails.
In my area of drug reactions and that, I've always been, but even now, people are asking to hear more about all the differences in trying to make diagnoses. I want to go back to the virtual care thing because in the Greater Toronto area where I work, when I'm doing virtual care, I'm saving people from having to come in and bring their 90-year-old father who's on dialysis when we can actually just discuss this on the phone? If you look at an area like urine where people are very spread out and the skill set's very spread out, again, virtual care makes a lot of sense. And it has always been touted as what the future would be. COVID accelerated that future, made it real. Governments realize you can't put that genie back in the bottle. So what do you see? Are you excited about what the future can be with virtual care?
I am excited. You know what? I think like a lot of things in, healthcare, medicine, and life, it has a tremendous benefit, but there are some things that we need to look out for. I think we've discussed about reducing inequities in care. And it's also an opportunity for us to advocate as physicians on a broader level, right? We need broadband because without reliable internet connection, they actually can't take care of many types of virtual care. So that's an opportunity for us to advocate more broadly. Obviously, there's many other benefits of broadband throughout Canada, but that is one practical example that we can advocate for as physicians. I think, there's a lot of privatization of virtual care, so that could potentially be a problem if it's siphoning resources, including human resources, from publicly funded healthcare. So that's something that we need to watch as well. I'm a board director for Canadian Doctors for Medicare. And actually, just last night, we had a discussion in terms of how to innovate care in our publicly funded healthcare system. So tremendous potential and opportunities, but we have to kind of do it the right way. Other issues involve privacy and access to information. Of course, virtual information has a greater threat to being breached than a paper chart, for example. So that's another potential threat. We don't want kind of one-off or fragmented care to be something that increasing with virtual care. We still want virtual care to be part of continuous and comprehensive care.
Do you have people who are so-called, if you will, patient advocates or patient representatives, or is it just doctors sitting around talking about what needs to be done?
I'm on a number of committees. I'm also the Assistant Dean of Social Accountability at Memorial University of Newfoundland. And in that capacity, we are forming the terms of reference of the Social Advisory Committee. And we will indeed have multiple folks in the community. So as you mentioned, patients, community representatives that are not physicians and not even associated with the medical school or the university at all. And I agree that it's important to have those perspectives in general. And certainly when we're talking about advising how the medical school can participate, increasing access to healthcare to the communities we serve here in Newfoundland and Labrador. Some of the other leadership roles that I'm part of, are physician only. For example, the Newfoundland and Labrador Medical Association, to be a physician, to be a member. And then and some other ones, Canadian Doctors for Medicare. We are changing our governance structure actually to have more formal patient feedback. And we do work with non-physician advisors, including policy analysts. I agree that very important to have patients' voice because, of course, that's the whole reason we're doing all of these things, right? To improve patients' outcome.
Just listening to all these options of what's going on, and I assume medical students are probably represented in many of these committees that you're on. Is that a fair assumption?
Yeah, a number of them, we have medical student-specific positions just for that reason.
Do you have any one or two or three big wins that you've had so far that you're really proud of and something that represents you and what you're trying to get done?
I'm a member for the Equity in Medicine national team. I think we had a very successful conference the past year, and we had, many diverse views on reducing barriers to underrepresented folks that want to be leaders in medicine in Canada. So I think many hundred members of this relatively new group. So, I think that one's important. In my role as assistant dean, I just started last November. So in my first year of the 3-year term, we're still kind of gearing up, make sure we have all of the resources. But, that one probably my busiest role. And I'm, looking forward to that, certainly. And as part of Canadian Doctors for Medicare, of course, we are interveners in the CANBI trial. So, so far things have fortunately been going our way. I mean, it's hard to call it a win. It's kind of an ongoing fight,
For some things that I've been involved with for really decades even, they are changing so quickly now. Like every week, I'm seeing 2 or 3 major articles, some of which I might be reviewing. It's like a tsunami of stuff coming in. Things just change so fast. I mean, how can you keep up with it? And in all of these roles, there's almost an expectation that things are going to change quickly. But once you finish one thing, there's another aspect to it. It's been a very strange few years. Is it a bit of a threat to have all of this stuff going on, all these balls in the air type of thing?
Yes and no. I think certainly, burnout, and we don't want to overextend ourselves. I think one thing that I've done is I've decided early in my career that advocacy, leadership, management are going to be important parts of my career going forward. So I've dedicated time towards that. I think certainly it's hard to keep up if you're trying to do it all off the side of your desk. I've dedicated, a number of half days per week. There's no patience. So I'm catching up on administrative tasks, writing and communicating meetings, etc. So I think that's important just to make sure you're juggling everything, knowing when to delegate and knowing when to quit and when to move on, right? Sometimes, it's time to move on. You can't kind of overextend yourself and finding out what's really kind of important to you. And yeah, sometimes you need to send a letter and resign. That's something that I teach folks that I mentor, that sometimes, you need to kind of find what you're really passionate about. And, you can't kind of do everything. You can't be everything to everyone. So that's an important lesson that, medical students tend to be kind of type A. So that's something that I've had to kind of really instill in some of my mentees.
That's really terrific. I mean, I think those lessons are very valuable, and especially, I think now, but the technology has instantly, over the past decade, 2 decades, really put a lot of pressure on people. And for some of my trainees, I had a review on what's called good enough, just to say, you can go to bed at night and you don't have to have finished everything perfectly. It's probably good enough. You're empowering people to do these good things, which is really terrific. What's next? And, what do you see as a couple of the obstacles and how you can get over it?
I've taken a real interest in governance as of late. I think, good governance, some people find it very boring, but it is important in kind of setting the structure, the reach, preventing some, liabilities of organizations. The person kind of behind the scenes, setting up the rules and the governance of some organizations. As I mentioned, Black Physicians of Canada, I'm so far their only physician advisor. I was kind of there from the beginning of the organization, helping to kind of contribute to that group. I'm really encouraged that there's many groups forming that are dedicated to equity and advocacy. So I'm happy to kind of be part of that in different realms. I also, in my role as Assistant Dean, Indigenous Health is a major part of my portfolio. So I'm happy to see a lot of, attention towards issues that Indigenous folks have, unfortunately been facing for far too long in Canada. So I am encouraged. And it's not that these groups are just finding their voice. I think they've always had their voice, but now, people are actually starting to listen, which is encouraging.
Are these things all volunteer?
All volunteer. I get a very modest stipend in my role as Assistant Dean, but yeah, the rest of them are volunteer.
I ask because I agree. And I think the volunteering stuff is in of itself just a value. I mean, people then, especially the people you're working with in these groups, respect you for doing that. And they understand whatever it is, like you say, financial loss is a potential, but still it's good for the soul. And it really gives you a purpose and a drive. Is there anything else that you think we should be talking about, the message that you wanted to really get out there?
I think that, the pandemic has kind of revealed, and you mentioned we've accelerated virtual care quite a lot, and as well as also revealed some other inequities and some other kind of priorities that we could retain. So, race-based data is something that we don't collect in Canada like they do in the United States. And of course, when we started collecting it, pandemic helped spur that along. We realized that Black and Indigenous folks have poor health outcomes, increased morbidity and mortality from COVID-19, as well as folks from lower socioeconomic statuses. So, some things like that have been seen with the pandemic cannot be unseen. So even after we get through this pandemic, we have to address that. And I think we have a renewed focus and an obligation to address that. So I'm happy that folks are taking action in that regard.
Listen, Bolu, I want to thank you so much for this, and congratulations on all your great accomplishments and all you still are going to do, and all the people that you've inspired and taught and led. So thank you so much in being such a critical part of the fabric of dermatology in Canada.
If you'd like to learn more about Dr. Ogunyemi's practice, follow him on Twitter at Ogunyemi, MD. If you liked this episode, please share it with your friends and colleagues. On our next episode, Neil will welcome another guest from the world of dermatology. To subscribe, go to www.derm.city or find the SLP podcast at Apple iTunes, Stitcher, Spotify, or wherever you get your podcasts. Support for the SLP podcast was provided by Leo Pharma Canada. Send your comments to slp@chronicle.org. Until next time, be well.